Good morning, everyone. Good morning, Arcview community. It is so great to see you all again. I've missed you guys. It's been about 3 weeks since we had our last get-together. It was our New Jersey roundtable. So I hope you all have had just a wonderful holiday break and ready for what will hopefully be, fingers crossed, an incredible year. I don't know if you know this, but next week is my 1-year anniversary here at Arcview. And since stepping into Troy's shoes, which, by the way, I'm still working on filling, we have done some amazing things despite the challenges that we had from 2020. So Arcview Ventures is not just up and running, but it's expanding with new members and some great new companies. And we've got some new funds coming your way, so stay tuned for that. Arcview Capital has a robust pipeline of amazing deals. That's our broker-dealer. And just a few weeks ago, we announced the spin-out of Arcview Management Consulting. So now we get to work with global 500 companies, also here in the U.S., great companies, on helping them with their hemp and cannabis strategies. So my crystal ball is still a little foggy, and I'm certainly not going to make any big predictions this year. I kind of got caught with that a little bit last year. But I think there's some really great indicators that are pointing us in the right direction for our industry. First of all, we have some interesting political moves here over the next couple of days that will hopefully change our playing field. We also have several states that have now legalized cannabis, and we're going to be highlighting these in these town halls this year. So stay tuned for that throughout the next couple of quarters, where we really get specific on these states. But these states are opportunities for new jobs, new wealth creation, and new opportunities for investors. We also have not one, but now several vaccines that will hopefully become readily available so we can plan, get this, a live get-together. I am so excited. We're looking at probably later in the year, depending on how things happen and the trajectory of the COVID pandemic and things like this. But let's get hopeful and try to get back to our signature events. But one indicator that I think we really should keep our eye on is the public markets. We had quite a shakeout in 2019, early 2020, and we're still recovering, but we are seeing some incredible opportunities for solid U.S. companies like Hemp to access these capital markets and to provide liquidity to current investors and to gain net new investors. So before I introduce our amazing guest today, a few housekeeping items. So at the bottom of your screen there, you have your Q&A button, and I want you to put in your questions for Jason. So we're going to go ahead and get to those questions after he and I have our fireside chat. So please make sure you put those in so we can field those appropriately. And if you want to connect with Hemp directly, go ahead and use that chat feature on the side and put in your contact information so that way they can get you information about their company and their products, and you can communicate with them directly. So Jason, why don't you join me on stage here for just a second before we roll our fireside chat that we recorded earlier. But it's my pleasure to introduce you to Jason Mitchell. He is the co-founder and CEO of Probulin and Hemp. These are two leading brands in their categories, and they're poised to disrupt their industries. Jason is a naturopathic doctor. He is a pioneer. He is board certified, and he's a member of the U.S. Hemp Roundtable. And prior to Hemp, he built one of the leading vitamin companies and launched more than 300 dietary supplements and related products into the market. Jason, truly a pleasure to see you again. And let's get rolling on our fireside and then answer some questions live.
Thank you. Nice to be here, Kim.
Hello, everyone, and welcome to the latest edition of CEO Circle, sponsored by Arcview. And I'm excited to be talking today with Jason Mitchell. And Jason is the founder and CEO of Hemp. And we're going to hear about Hemp today. But first, I want to introduce Jason, and I'd like you to tell us a little bit about you and your story and how you got into cannabis.
My name is Jason Mitchell, as you said, but I'm a board certified naturopathic doctor, and I've been in the natural products industry for going on 23 years now professionally. And it's an area of passion for me because my family have kind of been involved in it for decades. My mother was the assistant to the founder of GNC back in the late 70s. And through the 80s, she had a health food store chain. So I come by the natural products industry very, very honestly, right? So as a young teenager, I made some mistakes, as kids do, doing things that are stupid and silly and shouldn't be doing. And I had the great fortune of having some really interesting influencers in my family. In fact, we lived next door to Nancy Reagan's parents, Dr. and Mrs. Davis. And so I had the luxury of knowing the Reagans at least a little bit for a part of my life that was pretty special. And she had a serious impact on my life with regards to say no to drugs and things of that nature. And so I grew up with this concept in my mind that anything that was seen as a drug was that's wrong. Even though I made my mistakes in that arena as a kid, early on in my career, if you were to ask me about cannabis or things of that nature, I was staunchly against it. I mean, I was like, that's a gateway drug. I mean, at all the terms that you would expect to hear, right? Like, I wasn't even going to consider that there was any medicinal component, that there was any beneficial part of it. I would have disqualified it on its face until 2011. I got sick, very sick actually. Was diagnosed with a disease called ulcerative colitis. Now, I don't want to suggest that hemp fusion cured me or anything of that nature. It didn't even exist at the time. But at the time for me, I had already been through naturopathic medical school. They didn't teach anything about the endocannabinoid system, so I didn't have any express knowledge of it at that moment. And to be honest, in the industry, it was still relatively new, only identified in 92. And, cannabinoids have only been researched since, the late 60s or so forth. I mean, I'm sure it goes back a little further than that, but some of the concentrated research. And so in 2011, when I got ill, I got inspired to say, man, this is not a good place to be. And if somebody had told me that cannabis would have helped me at that moment, I would have been so venomously against it to the point I would have disqualified it, I would have argued. It would have been like the most horrible political debate, right? Like, it's just awful, right? So until I learned about a terpene that was called beta-caryophyllene. Beta-caryophyllene is a terpene that's commonly found in clove and black pepper, and it too supports the endocannabinoid system. And it has these anti-inflammatory effects and immunomodulatory effects, at least it's what the research would suggest. And so it led me to the discovery from my own sense what the endocannabinoid system was about. And it was through there that I became aware of CBD. It was through there I became aware of cannabis. And then I was like, oh man, have I been wrong? I was, me and some partners founded Hemp Fusion. And it was almost apologetically saying, hey, sorry I was so stupid. But we're now going to make change and we're going to do something special in this area. So,
but Jason, that's the hardest part, right? We're overcoming 40 years or more, at least my generation is, on the war on drugs.
Right.
And, I grew up in Ann Arbor, Michigan, where pot was essentially legal, my entire growing up, but still it was such a taboo to even think about, having any kind of positive effect. And, what a disservice. And like you said, we're still apologizing.
We're trying to recover from the ignorance. Mm-hmm. The fact is there's so much benefit that can come from this that outweighs anything that would even remotely be close to anything negative. And I would say that there's a future here that is, I think, going to unlock mysteries for scientists and medical professionals for decades to come. So there's such an amazing area to look at here. So I'm very excited about what the future brings.
So, all right, so you were inspired and you started Hemp Fusion, which, by the way, is an incredible company, and congratulations. From what I understand, you're in over 4,000 retailers in all 50 states. You've got a family of brands. So let's talk about a little bit about that journey starting this company, because this is also prior to some of the states even being legalized in various ways, hemp still not being in the Farm Bill. And so let's talk about that.
Absolutely. So in 2015 is when the corporation was formed. Mm-hmm. Okay, so we formed the corporation, and my business partners at the time, or still are today, is Ian Dick-Hedois, who's my co-founder, Andrew Oliver, and Ryan Griffith are my co-founders. And the four of us kind of came together in a unique twist of circumstances, which is really probably a conversation for another day, but it's turned out to be something really wonderful because we all have interesting stories ourselves. And they have influenced me in so many different ways because they're generationally different thinkers. I mean, they're millennials and I'm a Gen Xer, and so together I think I became a Gillennial. So
Millennial. I love that. That's great.
So when we formed the company, there was the position of, okay, is this legal? And that's still a question that we're still up against today. Although I would tell you that it is completely legal today. In 2016, though, I would say it was a little gray. Because in 2015, when we formed the company, we launched our first products in July, right around mid-July 2016. And at that time, and about the year prior, we were looking at this saying, okay, the only way that I would be willing to do this is that if we can show a proper legal path for these products, right? That it would have to be compliant. See, I've been in the industry for 22 plus years professionally. I have a lot of experience with the FDA and how they work. And under the Code of Federal Regulations, everything that led up to the establishment of GMPs, all the required elements. And then I've also seen how the FDA reacts to other substances in past history, such as red yeast rice and ephedra, and how they've developed prohibitive scenarios in and around these ingredients, and how they were managed and what ended up effectively happening with these different ingredients. And my belief is that cannabis was not only going to be or hemp was not only going to be the same, because at the time it was still listed on the Controlled Substances Act. That's going to be a little bit that I think the government still wound up in their own underwear over, right? Like, I think that there's still some challenges of getting over that. See, we founded our company very simply on regulatory compliance. And this is down to claim language, making sure that we have the proper structure function claims that are in compliance with DSHEA, which is the Dietary Supplement Health and Education Act that was established in 1994. And then you have the Food and Drug Cosmetic Act, which lays out where can you use ingredients and what's established. Then you have to look at the GW Pharmaceuticals and their IND that is estimated that it was filed in 2006, right? So there is the IND preclusion, as they call it. And so there's all these little nuances that when you look at hemp look like an insurmountable task. Like, it was just like, how the heck are you going to meander this? And so we partnered with a law firm called Amin Talati Wasserman, and they're just absolutely amazing. I trust them so immensely. I think we might have been their first hemp client, right?
Oh, wow.
So
great.
We worked with them to establish, let's look at this whole landscape. Let's identify this. So where I know a lot of people's genesis stories are saying, oh, I have this perfect product with these amazing ingredients that have great results. Well, unfortunately, if you don't come at it from a regulatory perspective in the beginning, there was going to be some painful years to come, because what it did was it forced us to think about things way before the FDA was going to make it a requirement. I sit on the committee for science and legal, and our chief marketing officer is the president of the U.S. Hemp Roundtable. So we have kind of a unique vantage point to see the communication back and forth between Congress, the Senate, and also with feedback from the working group within FDA for CBD and so forth, and what their real hangups are, and what their stringent language that they actually want to propose. And trust me, the language is not nice. It's pretty strict. And so when we see all of this, starting back in 2015 and 16, we said, all right, the regulatory path is required. We said, what is going to be the biggest concern for the FDA? And we believed that human safety was going to be a big issue. Right. And it has proved to be true, because what they want to make sure is that products on the market are safe. So we embarked.
Well, isn't that their main role and objective anyway, right?
It's completely.
So why not make that easy for them to get there 100%. And working with them, like you said, and building products that have this in mind before you come up with a great label and something that tastes good, right. Making sure you're compliant.
100%. Compliance has to be the case. I mean, yes, making great products, and I know we're going to get to that at some point. We really do make great products, but you have to have the backbone be based on what is required under the law. And so I don't believe that they're going to change any of the laws. I think instead they're going to decide whether CBD fits within them. And then within what standards are they going to hold us accountable, and what levels of discretionary allowances are they going to allow for? Because they have it within their power to do it. So because human safety was such an issue, with our raw material and our supplier, which is an exclusive relationship, by the way, because it's a very unique material and what separates us, and I know we'll get to that, but we started doing toxicology and safety studies over 2 years ago.
Oh, that's fantastic.
Because it was something that we felt compelled to do as our responsibility. I was focused more on the regulatory path and the safety issues than I was even of marketing products at that time, because a lot of companies that went out in the very beginning and created a bunch of revenue, they're struggling at the moment.
So Jason, let me ask you about that, because, I think one of the things that really sets you guys apart is this level of trust that you've been establishing since day one. And really, like you said, focusing on, being compliant. How many companies are out in the market right now, and what percentage would you say are even in that realm?
Well, I'd like
to put you on the spot.
I'd like to believe that the spirit of everybody would be to be compliant. I just unfortunately believe that so many of them that enter the CBD market are wholly ignorant of what it means to be compliant. And it's not that they're willfully going out trying to break the law. I just think that they see an opportunity, they want to capitalize on it, because I think capitalism is real, and it's okay to look for things to make money, but I think they just don't understand. They don't understand that there is this thing called 21 CFR, and it's Part 111, 117, 217, all these different regulations that exist within FDA and all these rules. And I think they're ignorant of them, and I would say the vast majority are. And when you ask them about something like GMPs, they don't understand that they themselves, even if they don't manufacture their products, have a certain set of requirements under GMP that they have to adhere to, not just the manufacturer. I would say that out of the some 3,000 brands, I don't even know how many brands, honestly, there's a ton of them, but out of the some 3,000 brands, I'd say, truthfully, less than 100. In my humble estimation, that's just my opinion, less than 100 are compliant. And I'm only aware of 2 others other than ourselves that have gone to the extent we have with toxicology studies.
Well, so, again, we've got investors, we've got, quite a large community in Arcview. And what I would love to impart to these people listening today is, as investors, we want to look at companies like yours that are doing these things because, we have a risk checklist. And there's enough on there anyway, being in cannabis, being in hemp, banking, and all these other things we get. But if you can avoid these risks by doing these things to start, to me, that's really the most important. And I think that's one of your key differentiators. We also talked about trust, right? And building that trust and sticking true to your word, which you've been doing. And so I congratulate you on that, especially. And I think it's a testament to your growth and, some of the plans that you have for this brand, which I'd love to get into as well. So
when it comes to trust, it's kind of important to mention this, is that we also identified within the retailers we're already in, which are primarily into independent health food stores, retailers, and things of that nature in the US. The biggest retailers like conventional, big box, mass, food, drug, and mass, convenience, these retailers have an interest in CBD, but they have a very low tolerance for risk. Mm-hmm. And being compliant minimizes their risk. And it actually gives larger opportunities to expand in a much broader fashion. And it gives you an ability to actually reach more consumers with great products, but allows a company like ourselves to grow in a very unique time when, even 2 years ago, there was a lack of understanding. And even today, I think there's still a lack of understanding to some degree, but I think more people are willing to look at a CBD product as an option, but to be trustworthy is important. We have a page on our website called Trust and Safety. I mean, it literally takes you through knowing everything from our organic farming, everything from how we manufacture our products. If you want to look up one of our products and make sure that it has in it what it does, what it's supposed to, as well as to proof that it doesn't have things that you would be concerned about, like heavy metals and microbiologic safety and pesticides. And you can do that by looking at the lot number and typing it in, and we give you all the test results. It's just, we totally and completely believe in radical transparency.
I love that. Radical transparency. I'm going to start using that if you don't mind. So I want to hear a little bit about what's in store for you guys over the next, 3, 6, 12 months. If you have your sort of crystal ball, post-COVID world opening up or possibly not. And then I want to talk a little bit about a financing that you guys have coming up, or a big company event, and we can talk a little bit about that. But let's talk about the company first. I mean, what's your thought on the future of Hemp Fusion?
Well, here's the beautiful thing. Hemp Fusion Wellness Inc. is not just a CBD company. It's actually diversified to a large degree. actually a company that I started in 2013 called Probulin. It's a probiotics company. In fact, according to Spin syndicated data, Probulin is a top 10 probiotics brand in the natural products industry, and it's the fastest growing brand in the top 10. Probiotics have become really important to us. In fact, in Sprouts Farmers Market, Probulin is the number 2 shelf-stable probiotic for Sprouts nationally. So when we look at this, we go, okay, this brand was awesome. And then as we grew, I then worked with my partners to start Hemp Fusion. And then in the summer of 2019, we merged the companies together. And there was a really cool ideology behind that too. We looked at Probulin as a Trojan horse, if you will. And why that's important is that retailers today that have a concern about hemp, we still need to be in the conversation. Probulin is something that doesn't have the regulatory hurdles, right? And so we start doing business with them with Probulin. We work with them and they have success with our brand. And all the while, we can engage in these conversations and be at the forefront whenever they decide to introduce CBD into their consideration sets. Because I don't believe that a hemp CBD company has to only be hemp and CBD. I think it can be a lot of things. And I think that being a well-diversified company allows you to stay healthy in different times. Like through COVID, believe it or not, probiotics are actually a type of product in the top 5 products that people use to support their immune system. So when you look at that, we did not suffer during COVID on the Probulin side. And in fact, Hemp Fusion held its own too, which was really awesome. And so I look at it and go, we have a really sound strategy. In fact, when you mentioned banking and about trust and the complications, because of our regulatory compliance, because of the diversity and how we set up the company, we attracted the likes of a very large bank to do our banking and merchant services, which was JP Morgan Chase. We were part of their pilot program where they brought in a select few companies that they were able to vet and verify that they were doing things correctly. I look at retailers that were once very gun shy about hemp and CBD are starting to become a little bit more open and looking for ways and paths to introduce these products. When they hear about us, when we become known to them, which is what we are now, we're known to all the major retailers now, all of them, with the Krogers, the Albertsons, the Publix, all the big retailers throughout the United States. They know who we are now, at least. And we're having conversations. In fact, we've launched with one and we're launching with a second and a third within the next coming months, which we're very excited. But these retailers are now starting to know us and seeing the regulatory portfolio that we have. And so the path that I see forward is looking at these retailers, minimizing their risk to the extent we can, and allowing them to have the products they want to. Because they're not going to risk selling bread and milk and produce to make a couple $1 million on CBD. They're just not going to do it. But if they can see a path where they can have these sales and feel comfortable and secure that they're offering their consumers what they should be offering in the right way, they're going to feel more comfortable about that. And I believe we've broken down that wall a little bit. And because of all the steps we've taken, they're very excited. So the future, we believe, is very bright. This is the time where we're going to shine differently than we ever have. So we're very excited.
Well, and I do love that strategy of your Trojan horse there, because that's basically how we started this, which is establishing trust. And trust is not just, the community that you're, working with and your employees and building trust there, but it's also with the retailers. Then it's also on the banking side. I mean, what a great testament to you and your company to get JPM to move the needle and get in this space. I think that's absolutely brilliant. Because they've been waiting, right? They've been waiting for a company like you to be able to, put their toe in the water, and having success with that brings more interest, right, from these big banks, which we absolutely need.
We respect them too, because we know they have a higher level of concern as a banking organization that they're FDIC insured. They have to make sure they do things right. And when that relationship came to be, we just know that it gave immediate credibility to us because, they're enormous, they're amazing, but we wanted to do what's right. We're always holding out to do what's right. And in fact, I've skipped things. I've literally let revenue slip away in order to do it right. And it's always come back to benefit us so greatly because the express levels that we move up after that are amazing. So
I want to ask you about your future funding plans. And I hear there's an IPO in the future for you. Is that right?
There is, absolutely. We're pretty excited about it. When deciding to do this, it really became very clear that it was an opportunity, not only as a fundraising mechanism, but to open up our company to a larger family of shareholders. It allows us to fuel the company properly to exercise the future of what we hope to accomplish also. It allows us to potentially look at acquisitions. of other organizations that may be a part of what becomes a collective under Hemp Fusion Wellness Inc. that could be the true successful company in the outcome. So I believe there's a lot of opportunity there, and we're just very excited about it.
Great. So I'm an investor, Jason, and I would like to hear maybe a top couple, like 1, 2, 3 things of why I should invest in you.
And that's a really good question. And that's always a hard one.
Put you on the spot.
Yeah, no, it's fine. It's fine. We make really good products. And these products are products that we believe consumers can count on to deliver a benefit to them, whether it be for stress or for assistance with sleep. And we have an entire line of products that are OTC products, meaning they've been drug listed. They have NDC numbers, they're national drug code numbers. So they've been listed with the FDA as drugs. We have 8 products that way. 2 is that we have set up a regulatory portfolio that allows us a very, very long future in this endurance foot race at building a successful company. And so it won't be where there will all of a sudden be a corner we turn and we're up against the wall and we can't move forward because of some regulatory inhibition. You know, we've looked at every possible angle of where the FDA could land on CBD and have accounted for that from a regulatory perspective, that we have a path forward regardless. So the third is that I believe that we've had a track record thus far of not only adhering to the compliance, but building great products, but that we're trustworthy. And that if we put out information, I'm very conservative. In fact, our IR team, they get frustrated with me sometimes because I noodle any press release to the point where I'm like, nope, it has to be 100% accurate. They're always truthful as well, but I'm like, I want to make sure. So if we say something and we put it out there, I think you can believe us. No matter what I say or do, I still have to perform. And if I perform, then our shareholders are they're going to benefit from that. And I have no intention of failing in any time soon.
That's a great I love that statement. I have no intention of failing anytime soon. Jason, I hear that Hemp Fusion is participating in a very important safety study. Can you give us some details on that?
Absolutely. We partnered with ValidCare, along with a handful of other companies, to not only financially fund, but to actively participate in the study using our products to be a part of what we believe to be the largest human observational liver and reproductive toxicology study that's ever been done, using CBD as the conduit of evaluation. And now this is something that the FDA has already said they want answers to. They want human data. And in fact, I believe the organization ValidCare has been in direct conversations with the FDA about this very study. And so as leaders in the industry, we felt it important for us to be involved, because at the end of the day, this might be a tool that the FDA uses to establish their framework.
That's terrific. Is there any information about this study out there if any of our members are interested in taking a look at that?
Absolutely. You can, if you don't know ValidCare, you can Google ValidCare, go directly to them, and on their site, they'll actually have all the information about the study. You can also Google ValidCare toxicology study or ValidCare safety study, and then you'll get the press release that actually gives you all the information. Or you can contact us here at Hemp Fusion at ir@hempfusion.com, and our investor relations team can provide you all of the information around the ValidCare study.
That's great. Fantastic. I hear you also might have something for our members and our community. So why don't we talk about that as well?
Without a doubt. As far as it relates to all the Arcview members, we want to make sure that they have an opportunity not only to hear what we have to say and hopefully believe what we're talking about, but nothing is better than trying our products.
Absolutely.
There's a lot of proof and application. So we would love an opportunity for any of these Arcview members that want to try our products to receive a special incentive discount to be able to buy our products and try them themselves. And so we definitely want to extend that to all of your members. So hopefully they gain the belief that we're already talking about here. We're radically transparent in that sense, but like I said, nothing better than trying the actual products.
Absolutely. Well, we'll get that discount code and post that up for you. So fantastic. Well, thank you. We appreciate that. And we always look forward to gifts. So there you go. Right. So we appreciate that. Thank you so much, Jason. And again, a pleasure having you here today, and can't wait to follow the progress and the success that is in store for you, even more so.
Well, thank you very much, Kim. It was nice being here. Appreciate it.
Terrific. Terrific. Thanks again. So we've got some questions. So I'm going to bring Lewis up. So he's our master of ceremonies here, especially when it comes to Q&A and filtering those. But before we do that, we have a little special guest here today to say welcome. So Delilah's here. Hi, Delilah.
Hello, everybody. Good morning.
So Delilah, you want to just tell everybody where you're from?
Yes. Well, so I am, first of all, good morning. Thank you for having me pop on unexpectedly. So I am with Toronto Stock Exchange. I'm the Vice President of U.S. Formation based in California, although today I'm actually calling in from Northern Canada, where I'm home for the holidays. But normally I'm based in Southern California. And so I've known Kim for a very, very long time. We've been in many circles together, especially on the women entrepreneur side. But my role with TSX is to work with U.S. companies who are looking to access capital in the Canadian markets. And so we are very excited and very proud to welcome Jason and Hemp Fusion to our market tomorrow. Looking very forward to see how that closes. And you are in very good company. Obviously, as you know, TSX and TSX Venture are the leading public markets for the cannabis and hemp related companies in the world. And so we hope that you, we're very excited to have you join us and to be part of a group of really great companies listed in the public markets.
Wow, thank you very much. We're really, truly honored to be listing on the TSX. We know that it's a high bar and a high hurdle because you have such a great reputation. And so we're incredibly grateful. And very excited about what tomorrow brings. So thank you. It's nice to meet you too, by the way.
Yes. And where are you based, Jason? I actually don't know.
I actually live in Tampa, Florida, so I keep it warm in the winter.
Okay.
Kind of a little bit of an opposite, you two, Tampa versus Northern Canada. So Delilah, thank you so much for joining us. We're going to get to some Q&A here with Jason. But if anybody has any questions for Delilah about this process, about the TSX, she can post up her email in the chat or we can connect you. Okay, thanks so much.
Thank you. I look forward to meeting all of you. Yes, any questions about the process or capital raising, please feel free to reach out to me. And again, congratulations, Jason, to you and your team and all your shareholders.
Oh, thank you very much.
All right. Well, thanks so much. That was an absolutely wonderful conversation. I learned so much, Jason. So let's get into the Q&A. First of all, hello, everybody. You may have seen me on several of our previous webinars. But if you're new, my name is Lewis, and I'm the VP of Operations here. And as Kim mentioned, happy to handle the Q&A here. We've got some really interesting questions that have come in so far. So let's get right to them. First, let's talk about data. A lot of people have asked about that valid care study that you have, that you mentioned in the video, Jason. So let's start there. You know, the world runs on data more and more nowadays. Ed Rodriguez asked, I'm going to paraphrase a little bit here since so many people asked questions about the study, but are there interesting data points from your research and studies that you could share? And are the results third-party validated? Let's start there.
So when it comes to the valid care study specifically, as much as we are co-funding and co-sponsoring the study with other brands, we don't have any, the protocol was something set forth by Valid Care that we all were able to see, but we didn't direct the outcomes. We're not involved in that. It is actually what's considered human observational, meaning the participants in the study were already avid users of CBD products and actually have used a CBD product or a product that contains CBD for at least 30 days or longer to even be qualified as a participant. And then from there is an evaluation at the end of the study. And what they were looking for is liver toxicity and very specifically male reproductive toxicity in the sense that, was there any changes that would be statistically significant? And, I saw one of the questions that came up on the Q&A as well, and I'll just parlay that in if you don't mind. And it's, were they looking at how much someone can take or what the right dose is? No, the answer is based on products that are already on the market in their varying levels of potency, right? They could be any difference. Like for our company, we chose 20 milligrams per serving of CBD. That was the product that we put forth for the users that chose to use the Hemp Fusion product. because participants also got to choose which brand of product they wanted to try from the participant brands. Some companies probably put up different levels, some maybe higher, some lower. And then some are using isolates, some are using full spectrum, broad spectrum. So there was a varying different use level as well as a use type as it relates to the raw material. And at the end of the study, I believe that the spirit of why they wanted to go down this road was that at the FDA's question are products that contain CBD safe? And so they wanted to make sure that there were multiple acknowledgments of different types of products that contain CBD, because I believe the ultimate goal, provided the data supports it, and again, none of us brands have any influence over what happens. The results are the results. It is a hands-off study in the sense that it is handled by a third party, exclusive from us. In fact, I don't even know the data points yet. They don't even share them with me until it's published. But I think the ultimate spirit, we all hope, is to show that no matter how much, no matter what type that you take, that it's safe, so that we can put this question to bed. Because we want people to know that they should not fear products if they are made by reputable and upstanding companies, especially if they're tested properly and so on. So hopefully that answered the question.
No, absolutely. Thank you so much. And thanks for parlaying into Shelly's question about how much CBD is safe or unsafe. Yeah. That's exactly where I was headed.
Yeah, no worries.
But on a related note, Ada Turner just asked on a related note about the difference between broad spectrum and panoramic spectrum. Did any of the studies get into any of that?
So no, the studies didn't get into that. So if you were to look at the industry as a whole, there are terms that I believe got hijacked. And I'm sorry that I say it this way, but the term full spectrum has come to be known in the industry as a product that is derived from hemp and that contains less than 0.3% THC, which is the stipulation guideline in and around the removal of the controlled hemp from the Controlled Substances Act. But then in order to give consumers a term that they could refer to for something that is non-detectable for THC, meaning below a much lower threshold, which I believe there are some offered up standards of less than 0.01%, but there is no federally mandated that says below this is non-detectable. And there is also, I mind you, no absolute zero. So broad spectrum has kind of come to be adopted or hijacked to mean, non-detectable THC. When we look at this, I am more focused on the word spectrum, because while CBD is an unbelievable ingredient, the word spectrum by definition means a wide array of things. And if you look inside this beautiful plant, not only is there CBD, but there are a multitude of other cannabinoids, terpenes, flavonoids, chlorophyll, so many other wonderful constituents that I'd hate to just throw them away just because people are excited about these three letters. Instead, let's embrace whole food, hemp is more of a whole food, if you will, because the seeds contain protein and fiber and omega-3, 6 and 9 fatty acids. So that's pretty cool. But the panoramic word is kind of a unique word that we adopted to use to describe. And if I can give you an analogy, an isolated CBD is kind of like a zoom in picture on part of someone's face or a profile. Full spectrum would be their full face, broad spectrum would be their full face. Full spectrum would be their whole body, and panoramic is all the scenery behind them. And what I mean that is that as you zoom out to look at what more is possible, we want to embrace all these other constituents that exist in hemp. And so I guess there was a little philosophy there in the sense that we really want to embrace this plant, not only for just the CBD, but all these other wonderful things that are there. And it's why we actually have what we call our whole food hemp complex.
Thank you so much, Jason. I think I learned a little bit myself. Now, on the topic of learning, now I'm not an ND, but one of the interesting things that I noticed when I was reviewing your company was the combination of probiotics and CBD. For lay people like myself, can you just dumb it down for me and talk about how the probiotics are helpful, and how does Hemp Fusion's hemp-based CBD actually boost its benefits?
So right now, there is interesting research, right? So you have the gut microbiome, which is this place where all this bacteria lives, trillions. It's estimated at about 100 trillion bacteria that live in the gut. But when you also look at the endocannabinoid system, they have these two primary receptors that everybody has been initially focused on. It's CB1 and CB2, and you can find information about them all over the web, and you can read. Hopefully it's a reputable site that you find, but we can obviously forward some pretty reputable information about that. but interestingly enough, a large dominance of occurrence of where these CB2 receptors exist is in the gut. And so I think it's an interesting possibility for the future and an exploration, if you will, on what the crosstalk or the possibility between the interactions of the endocannabinoid system and the gut microbiome. I mean, there is already medical professionals and scientists looking at the fact that the gut microbiome, there is this gut-brain connection. In fact, there are some estimations that there's more communication coming from the gut to the brain than the brain to the gut. In fact, they're looking at when, if you've ever, if you want to see this in real life here for a second, have you ever been so stressed out that you felt butterflies in the gut? Or have you been so hungry in the gut that you got angry in the mind, right? They call it hangry, whatever. So when you look at this, it's obvious that there's this unique collaboration there. And that the fact that there's such a dominance of CB2 receptors and that there's such a dominance of bacteria in the gut, it's an amazing potential collaboration. In fact, we already have the URL Cannabiome because we're looking forward to where this is going to lead and what type of research. We've already engaged, or not engaged, that's a strong word. We've already began discussions with a prominent university in Georgia to possibly explore this very notion. We're not there yet. We're working on it because I think more research needs to happen. But the two companies are not just accidental partners. It just made sense at a point to say, let's bring them together and see what the possibilities are.
Thank you for explaining where hanger comes from. I'm gonna have to try your products next time. The next time I feel that way. That's awesome. Thank you. Now let's see. Next question. Let's talk about the business strategy a little bit. And getting into big box retailers, right? We heard that many are not open. Some of them are, right? Especially in Canada. Actually, in one of our recent webinars, we had executives from Shoppers Drug Mart who talked about how they're using the HelloMD telemedicine platform, at least for the THC side of things. What is your strategy to get into big box retailers, and what will help these big box retailers get there?
Okay, so it's a really good question. Well, while these big box retailers, they have an incredible interest, right? High interest. And I know we said that kind of in the video, but they have an incredibly low tolerance for risk. And it's for good reason. I mean, they've built an incredible reputation over many decades of serving their communities, right? And so these communities know and trust them. And the last thing in the world that one of these retailers want to be associated with is a brand or a product or a type of category that could otherwise tarnish their already amazing reputation. And you can see that in areas where, where retailers have gotten involved in something and mislabeled or misbranded something or something of that nature. They're just so protective about their reputation, but they do realize that there is a huge future here. And the lack of communication from the FDA about guidance has made them a little bit gun shy. Now, it's obvious that in many of these retailers that they've already moved forward in the area of topicals. The topical use of products that contain CBD as an ingredient in them. We took a different approach because we wanted to make sure that they were solid in a really solid foundation, because what's really hard to their consumers is how to get them to understand what would a topical product with CBD be beneficial, right? So we instead went down the OTC drug listing process to where we have approved drug monographed ingredients that are designed for specific things like menthol for pain or colloidal oatmeal for eczema and so on. And then as part of our formulation, in our skin nourishing blend, we include hemp derived CBD. And so when we look at the big box, one is we say, okay, we know they're interested, but we want to make absolutely sure we can make them comfortable with products that are meaningful to their consumers. And so we're working very diligent and very hard on impressing them with our focus on regulatory compliance. So I think we've built a rather strong regulatory portfolio that gives them a lot of comfort. And as a result, we're in some really advanced conversations. In fact, one of the largest in the US we've already launched with and are already having some success. So we're excited about next steps, but they're being very patient. They're not expanding quickly. In fact, some of these retailers were ready to go in phase 2 last year, but have delayed now and still haven't done their phase 2 launches. And that's because they're being overly cautious. And I think that it's the right thing to do, to be honest, because you want to make sure you have reputable companies represent your retail establishment. So yeah, we're doing everything we can to give them confidence.
Absolutely. The tie-in between regulations with the FDA and other agencies and other big box retailers, I think the build out of those regulations will give those retailers more confidence, just as you said, to place more CBD products like yours on their shelves. Now, on the note of regulations, let's talk about, let's crystal ball a little bit about the FDA. The FDA has been slow, as you mentioned, and tentative in building a framework, rightfully so. They want to make sure that they're putting safe and effective products on the shelves, wherever that may be. Now, in your experience and in your conversations, what's your prediction? Where do you think the FDA may ultimately headed? Do you think we will ever have CBD ingestibles and edibles at some point? What do you think it would take?
Well, I can only go based on what history has shown us as opposed to predict the future, because I really don't want to do that, because I think anybody that tries to predict the future, you'll either be really right or really wrong. So I don't want to get in that. I don't want to be on either side of that. I'd rather be cautiously optimistic. I will tell you that the director of the FDA has gone on the record in an article recently saying we have no intention of prohibiting products that contain CBD. However, we do have a very strong interest in making sure that products are safe and that they're being manufactured correctly and done correctly. And I'm paraphrasing from the article, and I apologize if I misspoke in any of the words that were said, but he very much said, we have no intention of prohibiting. Do I believe that they're going to come out with some magical brand new set of rules never been seen before that just gives free rein to CBD products? The answer is absolutely not. I don't believe that. What I do believe is that they're trying to decide whether products fit within the current framework. They already have a very strong regulatory path and process, right? A lot of people have this opinion that products and dietary supplements specifically are not regulated. And that's just simply not true. We have a tremendous number of regulations that we have to operate under that start everywhere from sourcing, validating, manufacturing. I mean, there's just testing and qualifying and distribution and keeping track of adverse event reporting. I mean, we have a lot of regulations, right? And this is important because ultimately at the end of the day, it's consumer safety. Where do I think they're going to land? I think what they're going to do is they're going to require companies or subject companies to proving safety. And that's going to come in the form of submitting what is called an NDI, a new dietary ingredient submission, if it's for a dietary supplement. I think they could include the use of GRAS affirmation, which is generally recognized as safe. There is the possibility, and it's well within their rights, to establish what is called a discretionary enforcement level, meaning, below a certain milligrams per serving, they're really not going to have any say, and above which you're going to have more proof, but nevertheless, you're still going to have to prove that what you're selling is safe. I don't believe that it's going to be without a relatively strong, stringent set of guidelines that, by the way, already exist. And if you use other ingredients like red yeast rice and how they approach that in the past, I think the regulatory path is pretty well defined as to what I think they're going to land. I don't think they're just going to magically wave a magic wand and make it just totally legal, but I also don't think they're going to say it's prohibited. I think somewhere in the middle is where we live. And I think that's going to have implications on the international markets too, because I think they're all looking, and I know that some international markets would maybe not admit this, but I think they look to the US for some guidance on how the FDA approaches things, and they kind of follow suit with their own version of it. So I think it's going to have global implications when the FDA does speak, and I think that's probably why they're being careful too. They have a reputation to uphold. I think they're also concerned about making sure that products on the market do not also look, feel, or act like what is being sold as a drug, because that is prohibited. You cannot sell something as a dietary supplement that is also a drug. And so I think they're cautiously making sure they understand how to lay out that framework and say things like this are drugs, things like this can be qualified as a dietary supplement. I think that's going to be one area they're trying to define. These are my guesses. I will tell you that there are some proposed Senate bills that are in front of Congress right now, one of which is currently named 8179, but there's 30 sponsors to it. And so it's some really positive things I think are coming because Congress seems to be very positive. I think the wave that's going to happen post-inauguration, I think there's going to be some doors that'll open with regards to cannabis and hemp and so forth. This is at least my guess or what indications would lead to. But I think the future is bright. I don't think it's dim. And I also don't think it's gray. I think it's very black and white. I tell everybody the only way you make gray is by mixing black and white. So you got to start there first.
Absolutely. You're right. The difference between defining different cannabis-based cannabinoids, whether either as a drug or as a dietary supplement, That's going to be the key differentiator here. I mean, there's over 100 cannabinoids in cannabis, right?
That's
and
right.
THC and CBD take the spotlight, but there's a lot more research that needs to be done in order to discover what are the true effects and the benefits of each of these cannabinoids. Now,
Right.
on a related note, Vito Montona asked this question about age restrictions. I think that's one of the key elements of that difference between a drug and a dietary supplement. Now, to my knowledge, I'm not aware of dietary supplements that have an age restriction. Do you think CBD will ever go down that path in it only being available to people who are 18 or 21 and over?
Well, what I can tell you is that I know that there has been a rather significant amount of consistent legal guidance from regulatory law firms that say don't market products that contain hemp, CBD, absolutely THC related, but we're not related to the cannabis market. We're strictly industrial hemp. But it says don't market products like this to children. And I think it has a lot to do with the fact that that's a vulnerable population, right? In the sense that we don't do research on children. We don't know the safety protocols. We don't know the right levels of use and so on. And so that should be done under a doctor-patient relationship if that were to be used. And so we want to concede to that because, I mean, I'm a father. So the last thing I would ever want to do is participate in the marketing of products to someone that's a vulnerable population. And so for that reason, we do not position any of our marketing on the hemp CBD side to children. On our probiotic side, we absolutely do because probiotics are good. In fact, we have a product called My Little Bugs. Anyway, it's chewable, watermelon flavor. It's awesome. I love them. I eat them. But on the hemp CBD side, do I believe there's going to be age restrictions? Man, because the FDA has taken so long and still has yet to give some explicit guidance, states have taken it upon themselves to come up with their own guidance. I would be hard pressed to believe that at least one or two states aren't going to have some element of age restriction. My hope is that they don't approach it that way, but rather they approach it by marketing it to adults, right? Like do the proper and responsible thing until such a time we have research that says otherwise. However, I would have to believe that at some point, certain states may have age restriction related elements. But to be honest, if that was a requirement, not really what I want to have happen, but I would participate gladly knowing that the marketing of our products is truly to adults, at least on our hemp CBD side.
Makes a lot of sense. Thank you so much, Jason. Last question here. Are there products that we didn't get to talk about in the video today or that are in your pipeline that you're excited about? Maybe another iteration of the My Little Bugs product? And where can people actually find Hemp Fusion products? And are there other countries or states that you're planning on heading to next?
Other than the United States, right now Hemp Fusion is exclusively in the United States, but we're very excited is that we have a planned launch we're starting in Europe through Ireland. In fact, our products are already registered with the Food Safety Authority of Ireland. We do everything right as opposed to right away. So we always go through the proper authorities with registration. Some companies are actually selling products in countries that the municipalities and authorities don't even know are there necessarily. And so they're against the rules. So we follow the rules. So we're going to take a much more calculated and proper access to different markets. Our Provulen probiotics are already available in South Korea, throughout the United Arab Emirates, Mexico. So we've got a rather interesting expansion there. We've got some, hopes that we'll be able to expand even further because international is one of the markets that is part of our business planning. So we're excited. And some of the products that we have that I haven't talked about, but are gummy products. We have some hemp fusion gummy products that are really special and they're delicious. So we've cleared stability studies on them and so forth. And so we're excited. Plus, I just want to have them so I can eat them myself. They're fun to eat.
And I know I said that was the last question, but this is the last question, I promise. Now, here in the United States, right? I mean, you're in Florida, so I'm sure you're aware that this month is a pretty major month politically. How do you feel about the future performance of the company given the current political system in the United States?
Well, to avoid talking about politics in general, I feel that hemp and cannabis has a really bright future regardless, because I think it's hard not to acknowledge that there is some really sound benefit to this plant being outside of its prohibited state. I think that there's a really bright future, and that I think it doesn't take a rocket scientist to figure out with the research that's already happened and the momentum that's already starting that this jack's not going back in the box, right? So it's here. I think that certain political structures may be more favorable, but I have to be honest, the Farm Bill was passed under a conservative regime, and now we've got a much more liberal regime and so forth coming. And I look at it and say, I think they all realize that this is a wonderful thing, and that I think that it's not consistent with the war on drugs ideology of the past. I think we're kind of getting past that slowly but surely. But the ending of prohibition is painful no matter what political administration is in play. So I think that we're still going to have our aches and pains, but I think the future is bright personally.
All right. Well, thank you so much, Jason. I think that's all the time that we have for questions. I think I'll pass the mic back over to Kim. Thank you so much.
Thanks, Louis. And what a great way to end that. The future is bright. Got to wear shades, right? Is that the second part of that? But anyway, thank you so much, Jason. Really, this is terrific. We've got so much interest in your company, the process that you're going through, and we wish you all the best and good luck tomorrow.
We thank you very much. And thanks for having us, Kim. It's great to be with you again. So much appreciated.
All right. We'll see you around soon. So that's a wrap for our first event here for 2021. We do have a survey that just popped up. And as you know, Arcview community, this is how we live and die by what you guys want to see and the things that we can bring to you, information, opportunities in the marketplace. As I mentioned, we've got some great new things that we're launching with in 21, including Arcview Consulting. So Arcview Management Consulting is up and running. David Abernathy is one of the leads in that company now, as well as a new person we're going to be announcing here very soon. Very excited to have this gentleman join us from sort of the Big Four world. And so please, as I said, complete your survey. Check out Arcview Consulting. We do have some upcoming programs for January, so we've been busy over the holidays. We've got our showcase, which is going to be Asia Horizon. This is for accredited investors only, and we did this last year with Toast. So we're creating these SPVs, these special purpose vehicles, through our Arcview Ventures group to be able to invest in sort of these opportunities. So if you're an Arcview member, an accredited investor, please sign up for that and check that out. Our collective fund meeting is also on the 19th. So this is for members only, but this is also Arcview members. So if you're an Arcview investor, an Angel Network member, you can also participate in this. We have something really kind of fun with Zuber that we're going to be doing is they just landed a $65 million settlement on a lawsuit from a group in Las Vegas. And we're going to unpack that case. And so Zuber Lawler is going to be joining us with that plaintiff who did that judgment. And so we're going to really get to understand what that means and what does it mean for investors in the industry? What does it mean for companies in this industry? Because, there's some great companies that are doing some great things, and then there's some that we need to watch out for. And so we really want to kind of hit both sides of this. So that's going to be a really good one with Zuber, so don't miss that one. And then we have our first Arcview Access coming up at the end of this month, on the 28th. And I think we're going to be talking a little bit more about the sort of the federal legalization process and really what that means, and getting some really amazing speakers involved with that can really kind of, highlight for us what this pathway could or should look like, especially for investors. The other thing I wanted to throw out there for Jason, I know he's probably maybe tapped out and ready to run to his next meeting, but one of the things that I'd really like to include this year is women inclusion. So we're renaming WIN from a Women's Investor Network to the Women's Inclusion Network. And part of what building trust in this industry is all about is really looking at the data. And so part of what we're doing is we're working with other women's groups. We will be doing some studies that are gender specific with regard to all of the cannabinoids and really supporting those efforts this year with some more data, because we heard from you that data is important. So thank you all so much, and I will see you again here in short order. But Happy New Year and welcome to 21.